Hey guys, my name is Isabella and welcome to my channel. Before we get into today's video, I just want to remind everyone about a couple of things. First, my Patreon, where for $3 a month you can get 4 extra ASMR videos each and every month. You will also gain access to all of the previous month's videos as well. I also have an OnlyFans page, so if you think that might be something you're interested in, you can use the link down below to sign up for that. Also, down below you'll find my Instagram and Vizio page information. So my Vizio is where I make all of my custom content, so pretty much those are all the links listed down below. And lastly, just remember to like, comment, and subscribe to my channel. But now let's get into today's video. Hi, are you all ready? Okay, great. So how this is going to work is I'm going to lead you into your assigned room. You're going to get in bed, get comfortable, and then I'm going to go through some questionnaires with you, just ask you some questions, get some additional information about kind of your nightly routine and your sleep schedule. Once we complete all that, then we're going to have our nurse specialist come in. She will put all of the little monitoring devices on you, and then you'll just go to sleep and we'll study everything. We won't give you the final results. Well, your final results will be sent to your doctor, and that takes about 2 weeks from the time that the sleep study is performed. Okay, so just follow me. I will lead you to your room and we'll just get started, okay? Okay, great. By the way, my name's Isabella. I am the sleep expert at the clinic, so I will be giving you the full rundown on anything and everything, okay? Great. Okay, let's go. Okay, so are you comfortable? Yeah, I know. Yeah, the beds here are pretty comfortable, so most people don't complain at all. They actually say typically that it's much more comfortable than their bed at home. Yeah, we try to make it a very relaxing, comforting environment. We really want to help induce sleep, so yeah, exactly. Okay, so I'm just going to get started with my questionnaire. If you have any questions whatsoever, tell me to pause and just ask away, okay? Okay, so I'm just grabbing my laptop and I will just get started. So, let's see. Can you just spell your first and last name for me? Okay. And today's date, it is April 11th. Referring physician was that your PCP? What's your PCP's name? Oh, okay. Oh, I know who that is actually. Okay. Clinic location. Where is your PCP located? Right, okay. I knew it was in that area. Okay. And why are you being seen in the sleep clinic? Have you ever been previously evaluated by a sleep clinic? No. Okay. So that doesn't apply. That doesn't apply. Have you previously been diagnosed with sleep apnea? No. Okay. Let's talk about your typical sleep habits, okay? So what time do you typically go to bed on weekdays? Okay, so like give or take an hour or so, usually around that time. Okay, it's pretty decent. How long does it take you to fall asleep? Okay, usually like an hour. You watch TV in bed. Okay. What time do you typically wake up on weekdays? Mm-hmm. Do you use an alarm clock? Do you feel refreshed when you wake up? No. Okay. What time do you typically go to bed on weekends or days you have off where you might not have to get up for work? Okay. And how long does it take you to fall asleep on weekends? Okay. And on your weekends and days off, do you use an alarm clock? And when you wake up, do you feel refreshed? Okay. How many times do you wake up in the middle of a night? How many times do you wake up in the middle of the night, typically? Okay. That's like a typical night. Gotcha. Okay. Do you have difficulty returning back to sleep when you wake up in the middle of the night? Yes. Okay. So, typical causes for waking up in the middle of the night: snoring, nightmares, night sweats, pain, worry, headache, full bladder, thirst, hunger, heartburn, noise. If there's, if you have a partner that's in bed with you, kids, pets, choking, gasping. Have you on your own typically noticed any of these being the cause for what you, being the cause for why you're waking up in the middle of the night? Okay. The others, okay, it was heartburn, noise, choking, full bladder, thirst, hunger. Okay. Do you have any other causes that I didn't go through? Okay. Do you nap intentionally? And if so, how many days per week? You said you're not really a napper. Yeah, okay. Yeah, some people. How often do you or others notice the following? So you're going to give me, it's either almost never, rarely, some, often, almost always. And it's 0 to 4. So 0, almost never. 1 is rarely. 2, some. 3, often. 4, almost always. Snoring. Okay. Breathing pauses when you sleep. You wake up choking or gasping from sleep. Wake up with shortness of breath. Wake up with dry mouth. Wake up with sore throat. Okay. Nasal sinus congestion. Morning headaches. Wake to urinate. Heartburn interfering with sleep. Problems with fainting. Lightheaded when standing. Cold extremities. Grinding teeth while sleeping. Nightmares. Sleepwalking. Sleep talking. These are that you know of. Okay. Acting out dreams. Okay. Now, restlessness or discomfort in the legs. And if yes, is this worse at night? If yes, is this relieved by movement? Okay. Kicking or jerking of legs while sleeping. Hallucinations when falling asleep or upon awakening. Momentary complete paralysis when falling asleep or upon awakening. While awake, do you have episodes of muscle weakness brought on by strong emotion? How would you rank the intensity of your snoring on a scale of 0 to 5 if you snore? 0 being none, 5 being earth-shattering. That's what the questionnaire says. Okay. How likely are you to doze off or fall asleep in the following situations? So this is on a scale of 0 to 3. 0 is no chance, 1 is slight chance, 2 is moderate chance, 3 is high chance. Sitting and reading. That's a big one for me. Watching TV. Sitting inactive in a public place, like a theater or a meeting. Riding as a passenger in a car for an hour without a break. Lying down to rest in the afternoon when circumstances permit. Sitting and talking to someone. Sitting quietly after lunch without alcohol. In a car while stopped for a few minutes in traffic. At the dinner table while driving. Okay, how often do you experience each of the following? So I have trouble falling asleep. This is 0 to 4. 0, almost never. 1 is rarely. 2, some. 3, often, as in like 2 to 4 times a week. Whereas rarely is like once a month, and some is once a week, and 4 is almost always. I have trouble falling asleep. Okay. I wake up during the night and have difficulty getting back to sleep. I have frequent awakening at night, but no difficulty returning to sleep. I wake up too early in the morning and am unable to get back to sleep. I have difficulty waking in the morning. I do not get enough sleep. I am sleepy during the day. Daytime fatigue is a problem for me. Okay, so now this is the review of systems. So I'm just going to go through neurological, gastrointestinal, ear, nose, throat, heart, lung, eyes, endocrine, blood, psychiatric, general, kidney. Okay, you get the picture. Okay. By the way, I meant to tell you, I love your PJs. Yeah, it's so, it's so cute. I love when all of our patients come in all ready for bed. I love seeing what people wear. Okay, so neurological. Headaches, dizzy spells, seizures, fainting, memory loss, numbness, tingling, weakness. Okay, for heart, we have chest pain, palpitations, swelling of feet. Okay, lung, shortness of breath, coughing, coughing up blood, wheezing. Kidney or bladder, urinate frequently, painful urination, blood in urine, difficulty urinating, urinary incontinence, sexual difficulty. Okay, so for gastrointestinal, difficulty swallowing, nausea, constipation, abdominal pain, heartburn, vomiting blood. Now we have musculoskeletal, joint pain, swelling, muscle pain, back pain, okay, neck pain, any type of rash that you've noticed. Now for allergies, do you have seasonal allergies or eczema? Okay, let's talk about just general things. Do you ever notice fever, night sweats, loss of appetite, unexpected weight loss or weight gain? Okay, ear, nose, and throat. Do you have hearing loss, earaches, sinus pain, TMJ pain or clicking, nasal congestion, nasal drainage, nasal polyps, nosebleeds, mouth sores, hoarseness? Okay. What about visual changes or eye pain? You have really nice eyes, by the way. Okay, endocrine. Excessive thirst, heat/cold intolerance, hot flashes. Do you bruise easily? Are you anemic? What about anxiety, nervousness, depression or sadness? Have you noticed any irritability, moodiness? Okay. Do you have any allergies to medications that we should be aware of? Okay. Gotcha. Okay, let's talk about past medical history. In general, would you say your health is excellent, very good, good, fair, or poor? Okay. What's your current weight? I can tell you're definitely in shape. Okay. And what's your height? You're a really nice height. I noticed when you stood up to follow me. Do you know your collar size? Do you remember what your weight was 1 year ago? Okay. Okay, let's talk about medical conditions, okay? I'm just going to go through the list. A lot of these I don't think apply to you, but I still just have to go over them, okay? So, medical conditions: heart failure, heart attack, angina, atrial fibrillation, arrhythmia, high blood pressure, COPD, chronic bronchitis, asthma, okay, pneumonia, rheumatoid arthritis, lupus, osteoarthritis, fibromyalgia, spine or back surgery, liver disease, stomach ulcers, reflux disease, colitis. What about kidney failure, chronic sinusitis, seasonal allergy, nasal surgery, tonsillectomy, depression, anxiety, dementia, alcoholism, stroke or TIAs, Parkinson's disease, seizure, spinal cord injury, head injury, diabetes, thyroid disease, peripheral vascular disease, anemia, blood clots, any major trauma, chronic fatigue syndrome. Okay. And what is your marriage status? Are you single, married, widowed, divorced, or have a domestic partner? Single. Gotcha. Children? Okay. Work status. Are you full-time employed, part-time employed, retired, unemployed, self-employed, disabled, or a student? Okay. What is your occupation? Okay. Does your partner sleep in the same room? Does not apply because you're single. How often do you drink alcoholic beverages? Okay. Tobacco use? Okay, good. Please list any past or current recreational drug use, and just be honest. You're not going to get in trouble for anything. A lot of people lie to their doctors about some of these things, and we just want to take care of you. We're not looking to call the police. Okay. Okay. How many caffeine-containing beverages do you consume on a typical day? This is coffee, tea, Coca-Cola, Mountain Dew, sodas, you know. And what time do you typically consume your last caffeinated beverage of the day? Yeah, like some people have, they're like, oh, I don't drink caffeine past noon or 2, 4. Everyone has a different tolerance. Okay, great. So let's talk about family history. Instead of going through this entire list, I'm just going to ask, what's your family history? Do you have a family history of any types of diseases or sleep disorders, endocrine, lung disease, heart disease, neurological problems run in the family, like seizure, stroke, Parkinson's, any psychiatric or other, like blood clots, kidney failure, liver disease? or any other conditions? Yeah, like think about your father, mother, siblings, and if you have children, which you already answered that. So just based on those people, any health problems? Okay. Okay. Now let's talk about insomnia. Do you have problems getting to sleep or staying asleep? Okay. So now we're going to rate the current severity of your insomnia problems. So 0 to 4. 0, none, 1, mild, 2, moderate, 3, severe, 4, very. Difficulty falling asleep. Okay. Got it. Difficulty staying asleep. Got it. Problems waking up too early. Got it. How satisfied or dissatisfied are you with your current sleeping pattern? To what extent do you consider your sleep problem to interfere with your daily functioning? This could be just getting your work done, concentration, memory, mood, different things. How noticeable to others do you think your sleeping problem is in terms of impairing the quality of your life? How worried or distressed are you about your current sleep problem? Oh, don't worry, don't worry. We're a really, really highly acclaimed sleep clinic. We've helped so many people, and I know we'll be able to help you, okay? Okay, so I'm going to need you to sign this form, review it. I'm going to print it out. You're just going to, as you can see right here, you're going to patient signature, print name and date, and then I'm going to sign and date below, okay? So that is the entire questionnaire. Don't worry, you know, I can tell you seem distressed by, having to be here. It can be a little scary. I know, a little weird to know you're going to be monitored while you sleep, but I promise, you need anything at all, you just let me know, okay? We're here to help you, and I'll be with you every step of the way, okay? So don't worry, you're in very good hands. Yeah, of course. I'm gonna go get the nurse. I'm gonna tell her to hurry it up so that you can get to sleep. And, if you're having trouble, we have a TV. We can turn it on. We prefer that maybe you just try to fall asleep without it, though. It's kind of like a last resort if we really can't get you to fall asleep. But we want to take away all of the outside distractions, and just have you fall asleep. So we make the room really dark, make the temperature exactly as you'd like, and yeah, we'll just be watching you and seeing your sleep patterns. It's a really interesting process. Okay. Can I get you anything at all? Are you comfortable? You look very comfortable. I know, those beds are just so, so nice, right? I know, I wish I could bring one home. No, I actually did order the type of mattress that they are and have it at my own home. It's so nice. Yeah. Okay. I'm gonna leave you to it. Sweet dreams. Hope you have very peaceful, happy thoughts. And yeah, I'm very confident that we'll be able to help you, okay? Okay, of course, of course. You can call me Isabella. You don't have to call me doctor or anything. But don't let the other patients know that. I only let very special people call me by my first name. I always tell my very favorite patients that if you're having trouble falling asleep, you can't think of anything, then think of someone or something that makes you happy, feel relaxed. You know, a lot of people view me as like a comforting presence because I am going to help them work through everything going on with them. So if you need to think of me, fall asleep to the thought of me, that is okay, okay? It'll be our little secret, but it's only natural that you may want to think of me. Yeah, okay, I'm gonna go get the nurse, but sweet dreams. Thank you all for watching. I'd like to end this video by giving a special shout out